Hi, my name is Takehia Horton. I'm 36 and I have sickle cell disease SS. Um, Growing up as a child, it was going through a crisis is very, very, very painful, unbearable, undescribable. So, someone to ask me, "Well, kid, what does it feel like?" I couldn't even tell you.
Hurt.
It hurts. It's punching, stabbing. I think I would rather get punched in the stomach 20 times over instead of having a sickle cell crisis. Now I'm suffering from daily headaches, which are not migraines. They think they may be mild sickle cell crises that I'm having on in my head. Usually when I do have pain, it starts off in my arms and my legs, then goes to my back and my chest, and now in my head. But now the headaches are on a daily basis most of the time. Just having sickle cell awareness month during the month of September, it's a good thing, but not being aware of it totally is not the best. They try to do walks and things, but if it's not aired on TV or if it's not talked about on the radio or the news stations, then no one's really going to know exactly what it is we're trying to do as far as finding a cure or getting some type of treatment plans going on for the hospital so that when we do go in, we don't have to sit for hours on in the emergency room. Um, but we just need help getting the word out about sickle cell and letting the world know what it is we go through. We're not drug seekers. I'm not one to like to be on drugs when I'm sick, so I don't want to get hooked on it, so I'm not a drug seeker. And most of the patients who have sickle cell are not drug seekers either. That's one stereotype that we go through. I've had doctors tell me that I wasn't in pain, and
Mm-hmm.
they don't know what I'm going through. They don't know what the pain feel because they're just there to me sometimes to get paid. Sometimes when I'm sick, I don't even see my doctor. I see the nurse practitioner, or I see the helper. I don't even see my doctor sometimes. So they couldn't tell you what I'm going through. There was one time when I was having gallbladder issues. Goes to see my doctor and she tells me, "Oh, there's nothing wrong with you," and sent me home with 2 Tylenol. Come to find out, I had gallstones.
Hit the
So they
emergency.
had to do emergency surgery to remove my gallbladder. But the awareness is a big thing because no one knows about it. When I was in school, I would have people say, "Oh, what's sickle cell? Is it contagious? Can I catch it?" And I would laugh it off, be like, "No, you're born with it." Then you have to go to explaining. So me explaining it is one thing, but if people are made aware of it, then I wouldn't have to be explaining every time I run into somebody. Just recently, I went to the dentist, and the dentist was really fascinated with the fact that she knew nothing about sickle cell.
Mm-hmm.
Asking me questions when she should have been cleaning my teeth. Asking questions about the blood and what does it do and how does it feel, and just the questions that I would get when I was younger. So you're looking at 20 something odd years, and people still aren't aware of what it is that sickle cell is. So a cure would help out tremendously, just like any other disease. Finding a cure for sickle cell will help so many young children who are being born with the disease because the parents did not know that they had the trait or did not know that they could even pass the trait on to their children. So a cure, um, it would mean the world to me to be cured from sickle cell and not be tired all the time and not have to worry about if I go to sleep tonight will I have pain, because that's when my pain hit. I could be fine. I'm fine now. I can go to bed tonight and wake up 2 o'clock in the morning and be in excruciating pain. So a cure would really help out a lot.
This thing always happen during the night for some
I always
reason.
get sick at night.
During the
Always. I'm
nighttime.
fine during the day
Mm-hmm.
and I go to sleep for maybe 2 hours or so, and it boom, pain in my legs. Then it moves up to my arms and my leg and my back. And then I try to take medicine, and sometimes the medicine doesn't take, and I'll tell my husband it's time to go, and then we go to the hospital. T-Boz, Lorenz Tate, Jay-Z, Beyonce, Oprah, anybody, please support the sickle cell movement. We're trying to find a cure just like you did for ALS, cancer, asthma,
Yes.
anything. Just please help out.
Yes. And as a mother with a daughter with sickle cell anemia, I'm asking also to please support sickle cell anemia awareness and the cure in helping children, even children that are not owls, because one have to help the other. Thank you.